Understand.
Head lice are annoying insects as small as sesame seeds. They affect particularly children and people living in big crowds. It's highly contagious and can spread among school children and then to their families and can be difficult to get rid of. In this video, I have some advice for you to help you deal with the problem. Basically, lice live in the human hair, on the scalp, and especially in the back of the head and behind the ears. Lice live in human hair and has a life cycle. They are first eggs, or nits, and then nymphs, and then adults, and they feed on our blood. They reproduce at high rates and stick their eggs to the hair. We are dealing with insects that reproduce quickly. Every 2 weeks, there is a new group of eggs. That's why treatment should continue for at least 1 month while daily combing the hair to make sure that the lice is absent from the hair, especially the parts in the back of the scalp and behind the ears. With long hair, lice will be more difficult to treat. Let me explain to you how to do it. As I mentioned, treatment should be for at least 1 month with daily combing and doing the following steps. First, we must use a narrow-toothed comb made of metal with a double row, as you see here, or plastic or wood. White combs are better so you can get to see the dark lice on them. In case of repeated infections in children, I recommend that you shave their hair using an electric shaver, especially in boys. This will remove lice effectively. After we finish combing out the lice properly, you may face another problem, which is the attached eggs, or the nits. How can I deal with that? Another way is the manual way, by which you can remove the nits by the tips of your nails. First, you can spray apple cider vinegar. It will dissolve the glue by which the nits are attached to the hairs. Then leave it for about 30 minutes and then comb it. Sometimes you may need a stronger technique if the child is old enough. I suggest that you use a tongue or a hair iron, which is excellent because it burns the eggs. This will solve a great part of the problem, and you can use it once a week. We have 2 main aspects concerning treatment of lice. Lice present in the scalp, which disappears if you comb properly every day from the roots till the ends of the hairs. And then we have the eggs that are attached to the hair and cannot be easily combed out. That's why I would suggest high temperatures to kill the eggs and decombing to manually get rid of the big lice. Do not use hair irons for children less than 2 years of age because they might move their head and get injured. When you are using these combs for delousing, I would recommend that you use a white cotton cloth so that you can see the lice better. Make sure that the cloth can be washed at hot temperatures. After delousing, you can wash the cloth in hot water, 95 degrees Celsius or above 200 degrees Fahrenheit, to kill the lice immediately and to prevent it from spreading to others. Don't forget to spray your child's comb with alcohol after each use. You can also use some drops of essential tea tree oil, add them to your child's shampoo, and this will give an odor which is unpleasant to the lice, and thus will prevent the infection to come back. Please remember that the life cycle of the lice takes about a month. So there's an egg, a nymph, and an adult. And all these, we have to deal with them every day for at least a month to make sure that they are totally gone. Don't forget, the best way is to comb every day for about a month.
نعمل كده كل يوم لمدة شهر. كل يوم. دي أحسن طريقة. طيب ونفتكر نعمل إيه كمان؟
You can kill the eggs or the nits using a hair iron or a tongue, but that's for older children or adults. If you have a young child, younger than 2 years of age, you will have to remove the eggs manually. So first, you have to spray apple cider vinegar and wait for 30 minutes and then manually remove the eggs. This will take a long time, but it's the best way for your children. Beware that any chemicals we apply on the child's hair can be harmful, especially in young children less than 2 years of age, because it may be affecting their nervous system. That's why we have to prevent applying any chemicals to their body. Treating lice requires patience and repetition. Repeat the above steps for the infected children, their siblings, and their parents at the same day. Also, you should clean your home and wash all bed sheets in high temperatures. Clean the floor using a vacuum cleaner so as to get rid of the lice all over the house. It is well possible that the child gets reinfected from school. For that reason, I would recommend that the school implements a week of lice treatment so that all the children are treated at the same time. I wish you all good health. This video contains general information about medical conditions. The content might not be suitable for everyone and should not be treated as such. Always consult your doctor before using medications. The medical information is provided without any warranties or legal obligations to those who might apply them.